The case I will be presenting today is Miss M. Miss M is a 27-year-old mom, single mom, mother of three, ages 3, 5, and 6. She came to the shelter because of her abusive relationship in Florida. She was being verbally and physically abused by her significant other, and she decided to leave the house and actually to leave Florida because she wasn't feeling safe there. So she decided to come to Georgia, where she has an aunt, and the aunt recommended to her that she can get services through the shelter, and that's how she got into the shelter. Right now, she's been at the shelter for over 30 days, which is past the timeline that they usually allow participants to stay. But because of all the support that she is in need of right now, they are allowing her to stay for a longer period of time. Right now, the staff is working on the presenting problem, which is housing. Housing is a problem right now because, or they consider it a concern right now because even though they want her to be independent, they want her to be able to be by herself and her kids outside the shelter, she has shown that she is not in the best moment right now to be able to be by herself with them, as she has shown that she gets overwhelmed pretty easily. She is not able to manage the small, the little one behavior, as he is autistic and he has a lot of behavioral issues, and sometimes she's just not able to manage that. And that's one of the things, or one of the reasons why they don't feel safe by housing her or giving her a permanent housing where she can be by herself. So they are making sure that she is in a better state where she can be by herself, or at least have the appropriate services that will be being provided to her while she's in her own apartment or her own house. And another presenting problem is her anxiety. She has been having some anxiety attacks, and this is something that is also concerning, as she's being overwhelmed by work, by the children, by their behavior, by other responsibilities that she needs to accomplish as well. And another one is time management. During the initial assessment, she received the danger assessment. She's now working on barriers for housing, and she also received a psychosocial assessment by the case manager. She's very engaged. She's very willing to work with the staff. She's very open to any support that can be provided to her. However, sometimes it's difficult for her, as she has a learning disability, and sometimes she's very forgetful, or sometimes she just don't understand, even though the staff is very supportive and is trying to work with her in all areas. Some of the resources and articles that I was able to find that can help with her anxiety situation, and also with the housing, is CBT. CBT can help with her anxiety issues, so she can have a healthier and more effective ways to cope, as she is having these situations where she cannot control herself, and she's being verbally aggressive towards the children, because when she feels overwhelmed, she gets these anxiety attacks, and this is not helping her in the areas that she's working on with the staff at the shelter. So CBT is definitely one of the approaches that I will consider for her, and also some de-escalation techniques that will help with that. They are also working on referrals, and so she can get some extra services for when she is able to have her own place. Some of the interventions that will be used for her are counseling and or CBT therapy, de-escalation skills, time management skills, and parenting classes, as she's also having some difficulties managing the children's behavior.